of getting a job. It can be quite a tricky transition in other senses, but so that's sort of 2 years or so there. Then you're becoming a registrar, which is where you're doing your sort of subspecialty training. And down here, you know, there are the sort of the broad areas. So you can do that in GP, you can do that in medical. So, you know, heart, kidneys, lungs.
I'm Jared. Welcome back to another video by CareerOk. CareerOk is an organization, again, to help students in their careers and put them in touch with mentors in various different industries. Today, I'm very excited to have this eye-opening interview with Dr. Chris Ovens. He is a doctor currently training to be an ophthalmologist, an eye doctor. Chris undertook his medical training at the University of Sydney through the Doctor of Medicine double degree program while undertaking a Bachelor of Science Advanced. He's currently an associate lecturer at the University of Sydney School of Health and Medicine and tutors at the Masters of Ophthalmology course. The cool thing about Chris is that he's someone who's very, very passionate about helping young people decide if medicine is the right fit for them or not. As we all know, medicine is a lifelong career, and it's really important that we have all the perspectives we have possible. He's in fact written a book titled So You Want to Study Medicine, detailing his 12 years of experience that has brought him to where he is now and the lessons he's learned along the way. So I'm someone who's very, very excited for this interview. And just thank you so much, Chris, for joining us today, and welcome.
Yeah, no worries. Thanks for having me.
Yeah, no worries. So I only met you 15 minutes ago, and it was very nice to meet you, and you seem like a very nice man. I don't know if this is going to go in or not. So yeah, I'm going to start with the first question. So what were your reasons for doing medicine? And in hindsight, were these good reasons for doing so?
Yeah, so short answer, my reasons were terrible. So this was sort of in year 12, and House was a really big thing, the TV show with was it Hugh Laurie or whatever his name was. Anyway, he played this sort of enigmatic, super clever doctor guy who just went around and solved everything and said everything was lupus. And I was like, oh yeah, that'd be cool. I want to do that. And then I got the marks in the HSC, and that was, to be honest, kind of why I went into it. Like, you know, I like science and I like the human body and that sort of thing, and that kind of played a part. But yeah, when I chose to do med, I really didn't have much of an idea of what it was about, what was involved, what I was in for, all that sort of stuff. So yeah, terrible reasons. But that's why we're here, isn't it?
No, that's fair enough. I mean, we all know House is a super accurate TV representation.
Oh yeah, absolutely. Yeah.
It's like suits. Yeah, it's actually quite interesting. I'm sure there's actually other people in your position as well who have the marks, who perhaps have the option to do medicine, and will be watching this right now and find that quite useful. What do you think would make someone a good doctor? How do you know if someone's actually a good fit for a career in medicine?
Yeah, I mean, that's a tricky one. One of the great things about medicine, I think, is the variety of subspecialties and the variety of things that you can do with it. So, you know, you can be a pathologist and look at slides all day, and never interact with a human being, and that's a perfect fit for some people, and that's great, and they love it. There are other people who are pediatricians and deal with, you know, babies spewing all over them all day. Like it's so varied, and I find it hard to say that, you know, a certain type of person is a particularly good fit for it, because there are fits for so many different types of people. I suppose probably what's easier to say is what would make you not a good fit for med. So, I mean, I suppose in terms of the training, if you're not a fan of study, you probably, you know, maybe want to reconsider. I think some people go into med with a lot on their plate already, whether that be, you know, other jobs, kind of careers that they're trying to do at the same time, families, other commitments, all that sort of stuff. It is something that requires a bit of sacrifice. And so I think that would be, you know, you'd want to have a think about, you know, what you're willing to give up and how many balls you're trying to keep in the air at the same time, if that's you. I suppose it's a long haul, as we've already kind of alluded to. So if you're someone who likes to try something for a year and then try something new and then try something different and that sort of thing, maybe it's not for you. Um, and I suppose the other thing would be if you're in it for the wrong reasons, and we might get into that a little bit more later on. But if you're in it, to make a truckload of money, it's probably not gonna work out all that well for you. If you're in it for the prestige, if you're in it for because your parents want you to do it, I'd probably say that they're all fairly poor reasons to do it. And there'd be other things that if you want to do that would be far better suited. If you want to make a buttload of money, then go into investment banking. Don't be a doctor.
Yeah. So you touched on the ability to juggle everything that's on your plate, the commitment for the long run, variety. These are all kind of good reasons, and money, prestige. Not going to last long. So, sorry, Chris, I actually want to go back to the first question when you were explaining your reason for medicine.
Yeah.
You said that you had the grades. You watched House.
Mm.
Said that the terrible reasons. I actually want to clarify for the audience, why is getting good grades a terrible reason? Like, aren't doctors supposed to be smart? So if you get good grades, shouldn't you just go to medicine? Or what's that?
Yeah, so I suppose getting good grades is not a reason not to do medicine, but I suppose there are plenty of other things that that also require good grades, and it's not it shouldn't have been a reason for me to pick medicine over something else. I think House was probably the reason why I chose medicine over other things, and the grades were just a means to that. Yeah.
Oh, no, thanks for clarifying that. Yeah. So just because you have good grades, and there's many other things that are quite competitive out there, you can try and get it.
Yeah, absolutely.
Yeah. Question I have for you is something that I think is quite interesting. We know that in House, yes, it features Dr. House, the doctor. There are also nurses, paramedics, other allied health professionals that we draw inspiration from. Why should someone want to be a doctor and not perhaps a nurse or a paramedic or another allied health professional for that matter? What makes a doctor special in your experience?
I'd probably say that a doctor isn't special. I don't think, and the more you work in the health system, the more you realise that that's the case. I think a lot of people sort of go through med and think they're pretty hot stuff, and then they go and work a day on a ward as an intern and walk around with that attitude, and they're sort of put in their place pretty quickly. In terms of why I chose to be a doctor and not and not another sort of health professional, I don't really know. I mean, you can see that my decision probably wasn't the most thought out when I went into it to start with. But I think in retrospect, I probably could have been a paramedic. I could have been a physio. I could have been, a radiologist. A radiographer. I mean, I suppose there are some things that make medicine a little bit different from some of the other sort of allied health and that sort of thing. So I suppose there's probably more variety and probably less limitations in terms of what you decide to sort of do or specialize in at the end of it. And there's probably more scope for, I guess, I don't want to say progressing your career, but there's probably more avenues that you can go into compared to some other areas. But I mean, if you take nursing, for example, and say you're a nurse and you really like, neurosurgery, for example, there are neurosurgery clinical nurse consultants. And they go on the ward round with the neurosurgical team. They're contributing to management decisions. They know their stuff. The only thing they're not doing is doing the surgery itself. I mean, it's not. There's a lot of overlap with a lot of these different things. I mean, I was having a chat to someone who was a paramedic at the moment, thinking of doing medicine, and they were sort of talking about they wanted a bit more continuity of patient care rather than sort of picking them up, managing them in the short term, and then sort of handing them on. So I mean, everything sort of got its limitations, but I don't think that medicine is inherently better or anything. I think it's just a different a different career path. Yeah. So I think the take home, yeah, if you're considering medicine, you should probably also be considering these other things as well, because they may be a better fit for you.
Great advice. Thanks for that, Chris. Now, in your book, you've very thoroughly explained the path to becoming a doctor, intern, resident, junior doctor, all these terms that that get flown around everywhere. But you explain it very well in the book. But for those who haven't read it, would you mind explaining to us the journey from the first year of medical school to perhaps the endpoint, or the most common endpoint, and what are the different terms? Who is who? What does it look like along the way? How long is each journey, if you don't mind?
Yeah, sure. So I'd probably split it into sort of maybe 4 parts. So the first part would be medical school, where you're at university. You're learning about medicine, you're learning about the body, you're learning about drugs, you're learning about different conditions and diseases and that sort of thing. And you spend a bit of time at hospital sort of interacting with patients and getting a feel for what things are like on the job. That's the first part. Depending on how you do it, whether you do it as an undergraduate or postgraduate and which uni you go to, usually that's sort of 4 to 6 years at uni. The second part, I'd sort of say, is your sort of internship and residency. And that's basically where you're a junior doctor. You've just finished your university time. Now you're working in hospital full time. You have a job, which is nice, and you're doing things. You're treating patients. You're part of a team. You're learning. I suppose you're going from the book side, which you learn in medical school, to the actual practical side, which is an interesting transition. And you're doing night shifts, you're doing on call, you're doing after hours, you're doing all those bits and pieces. But they're still quite general years. Usually you do sort of 1 year of internship, then 1 year of residency, and then sort of plus or minus other sort of general years after that, depending on what path you take. So that's probably the second part. Third part would be your specialty training, which is where you decide what you want to do for the rest of your life. Well, you've kind of already decided you want to do medicine or a doctor, but this is where you decide what part you want to do. So do you want to be a pediatrician and deal with kids all day? Do you want to be a cardiologist and do hearts? Do you want to be a psychiatrist? Do you want to be a general surgeon? Do you want to be a GP? And all those sort of subspecialty training programs have a sort of 3 to 5 years usually training program, and that's when you're just working in that area, and that's when you're a registrar or an advanced trainee. They're probably the 2 sort of names that you'd get in that sort of period, and that's where you're learning your specific skill. And then, so that's the third part, and as I say, that's sort of 3 to 5 years plus or minus a bit. And then the fourth part would be when you're a consultant, which is where you are accredited to go out and practice whatever you've decided to specialize in, and you can for the most part be your own boss, call the shots, treat patients on your own, those sort of things. So and that's usually sort of the endpoint that most people are looking at. And so all told, I think the quickest you can do, if you do a postgrad med degree, which would be 4 years, intern residency, 2 years each, and then specialist training if you did a 3-year specialist training program. So then you're looking at 9 years. And then, so, but if you're doing that pathway, then you've already done a degree first, because you're doing a postgrad med. So if you're doing undergrad, then that's a little bit longer because the med course is a little bit longer. So I suppose another way to look at it is if you're thinking about this and you're a year 12 student, the quickest pathway, you're not going to get out much before you're 30. and obviously the later you start, that changes things. Like I'll probably be about 33 when I finish. But then you speak to bosses and they say, it doesn't stop there. Then you go and do other research and you go and do other sort of, bits and pieces. But that's a sort of rough guide.
You wish we could have a whiteboard to kind of write that all down. And thank you for that. You almost revealed your age there as well. But yeah, thank you for explaining that, Chris.
No, that's right. If you want, I can do a screen share. I've got that little diagram from the book. If you want me to just put that up.
Go ahead. Yeah, pull it up.
Does that work? Let me just get it. Let's see. All right, I'm going to screen share. There we go. Can you see that?
Yeah.
Yeah. So if you're a more visual person like me, this gives you a bit of a rundown. So you're in high school or you've done another degree. Then you come into med school, that's sort of 4 to 6 years. And usually getting into med school is, a little bit competitive. Then the transition from med school to your sort of junior doctor years, your internship and residency is a pretty easy transition for the most part. In terms of getting a job, it can be quite a tricky transition in other senses. But so that's sort of 2 years or so there. Then you're becoming a registrar, which is where you're doing your sort of subspecialty training. And down here, there are sort of the broad areas. So you can do that in GP, you can do that in medical. So, heart, kidneys, lungs, endocrine. Basically, you're managing things usually with medicine. Whereas the surgical side of things, again, there's sort of general surgery, there's neurosurgery, there's plastic surgery, there's all sorts of different surgery, head and neck, maxillofacial, all sorts. But the main way you're treating people is by actually doing surgery on them. And then there's other, which are kind of the harder to classify. So like, psychiatry, dermatology, ophthalmology, obstetrics, gynecology. All of those sort of areas have their own sort of training programs, but, all of them are a few years where you're doing the training in that area. And then you become a specialist, and that's where you can go and do your own thing.
Yeah. And I really like how you outlined the competitive, easy, competitive. A lot of people think that once they get to med school, it's like, I'm going to get a job and I'm guaranteed work. But you alluded to some doctors needing to try and apply for jobs.
Yeah, correct. So, you can kind of see over here on the left, there's SRMO or unaccredited registrar. And that's sort of because, for example, some of the training colleges which sort of run the subspecialty training, some of them only let in 2 or 3 people in a year. And you might have 50 applicants for that college. So, obviously the maths don't work. So you'll have some people who get onto that program and start doing their training. And you'll have a whole bunch of other people who don't. And so some of those people who don't go and do something else, but some of them basically want to keep trying, another year or 2. And so they'll go and do basically a job in that area, which doesn't count for the training scheme. So it's kind of like a practice year. So where they sort of do similar work to gain a bit of experience, maybe do a bit of research, make the CV look a little bit better, get some contacts, so that then when they go the next year to try and get onto that training program again, they'll have a better shot, basically. So yeah, and that can, I think the longest I've heard of someone trying on that sort of merry-go-round was about 9 years. And after 9 years, sort of someone tapped them on the back and just sort of said, look, maybe it's time to, think about doing something else because it's, clearly not working. But yeah, it's not uncommon, especially for some of the sort of smaller surgical subspecialties like, general surgery, ENT, plastic surgery, those sort of training programs, their numbers are tiny, getting on each year, and it's not uncommon for people to do sort of 1, 2, 3, 4 years of sort of unaccredited sort of practice years before they get onto that training program. So it's variable.
It's actually quite interesting perspective. So a junior doctor is anyone who's finished medical school after that, and then towards the end, basically, any one of those is considered a junior doctor. Oh, sorry, until they've reached the specialty.
Yeah, I mean, it's kind of a fluid term. I'd probably say, I mean, in terms of what New South Wales Health classifies as a junior doctor, it's basically anything up to a specialist or a consultant. But I'd probably break that junior doctor into two, where you've got your sort of general years and then you've got your specialist training years. But yeah, it's kind of an artificial thing.
Yeah, no, thanks for that. What are some specialties that are the greatest shortage, and what are some which are the most competitive? So maybe like numbers, like which ones have the least amount of people going in, and which ones are kind of the easier ones to go into at the moment, or the ones that they need.
Yeah. So, I mean, I suppose the first thing to say that all specialties are getting a bit more competitive now. You speak to consultants, and they sort of, you say, oh, how did you, did you do a PhD? What did you do to get onto your training program? And they're like, oh, I just, met the head of, such and such, and we went for a beer and we got on fine, and the next day I was on the program, sort of thing. It's like, oh, okay, well, it's not like that anymore. But I think in terms of getting a job at the end of it, anything rural or outside of metropolitan city, there's much higher demand for. Usually that will be in the form of a GP, but often rural GPs will have areas of subspecialty as well. So they'll do a bit of training in, dermatology or obstetrics and gynecology, or sort of bits and pieces. But rural GPs are quite highly sought after. I'd probably put Indigenous health in that category as well. I think there's a huge shortage there. In terms of the specialties where it's a little bit less competitive to get on, so I think traditionally GP or psychiatry are a little bit less competitive to get on, but there are still people who apply and don't get on. So I suppose that's the thing to keep in mind. There's always the possibility that you won't get on. It's just some programs, there's a higher chance of that than others. And then the more competitive ones, so as I sort of mentioned earlier, a lot of the surgical, sort of more subspecialist surgical areas, so like ear, nose and throat, like plastics, like maxillofacial, head and neck, breast and endocrine, they may have one, maybe two, maybe three people each year. And, part of that's because once you get out into the real world, there's slightly less common issues than people who need to go to a GP. So there's less demand in the real world for that expertise. Part of that is because the funding for those positions, so it's a it's a government funded training scheme, so it depends how much money the government throws at them. So it's easy to say, oh, well, there's this shortage of, such and such subspecialty, why don't we just train more? Well, go and ask the government why we don't train more. Yeah, I mean, from my experience, like in ophthalmology, there's about 10 people who get on a year, which is probably one of the more competitive, but as I say, it's not the most competitive. I've got friends who've been trying for a few years to get onto their subspecialty training program, and it's much harder. So, and then the other big area would be sort of physicians training. So they're all the sort of medical side of things. So cardiology, endocrinology, respiratory, again, all the stuff that you treat with medicine more so than surgery. And that's probably somewhere in the middle. Again, there are definitely people who apply and don't get on, but it's probably a little bit less competitive than some of the surgical side of things. But it varies.
What kind of drew you to ophthalmology in that case then?
Yeah, good question. I was going to do neurology for quite a while, because I find the brain quite interesting. And then So this is kind of a really good example of how probably a better way to make your decision than how I made the decision to start medicine in the first place. So I wanted to do neuro because I liked the content and the sort of the learning about it and found it really interesting. And, the different, the different spinal cord syndromes, and, if you know where the strokes happened, then you can predict what the outcome is in the body, and it's on that side, so it's going to affect the other side of the body, and it might affect that side of the face and that sort of thing. And I found that quite interesting. But then I did a few rotations in neurology as an intern and a resident, and I found that the day-to-day of doing neurology and the work as a consultant neurologist wasn't exactly what I had in mind. I wasn't the biggest fan of ward rounds, and there were lots of ward rounds. And just like a lot of the patients were very sick, and a lot of them, it was pretty sad for a lot of them, because they've gone from being, a perfectly well functioning, healthy person, and then bang, they've had a stroke, and all of a sudden they're sort of, bedridden and completely dependent on their care or that sort of thing. And for a lot of things, there's not a lot you can do for it. So yeah, and then I sort of did a master's in ophthalmology, sort of thinking, I kind of like the brain eye crossover. They're kind of close to each other, and even if I don't end up doing eyes, it'd still be useful for the neurology side of things. And then I liked the content in that as well, and I met a few eye doctors who seemed to really like what they did. And there's sort of talking about the mix of surgery and the mix of non-surgery. So some things you treat with tablets and drops, some things you treat by chopping it out. And you can kind of choose to do as much or as little of that as possible as you want. The lifestyle is generally pretty good. I don't know, they just all seem to be fairly happy. And that's kind of, I suppose, putting that next to the neurologists that I'd met, there was, I suppose I saw myself more doing opthal than neuro. And so then I started sort of pursuing that line of things a little bit more. And then here we are.
Seem like you live a happy life.
Sometimes.
That should be a really important consideration, like what makes you happy, what makes you happiest in the long run, because I reckon if you're happy in your job, you're going to do a better job anyway. So
absolutely, yeah.
Yeah. I'm going to move on to a bit more personal questions. So, like you mentioned, the average age of someone finishing, or at least becoming a junior doctor, is around 30, 33 for some people. Most people are having families at this point in time, or at least thinking about families. How does balancing your family tie into balancing your job in medicine?
Yeah, I think that's really tricky. And my wife and I are kind of trying to figure that out at the moment as well. But I suppose the main thing to say is that, if you want to make it work, you can make it work. It depends, it obviously depends kind of on how old you are when you start, and sort of where the rest of your life is at. Some people who go into med really young, they can afford to wait and get through all of their training and become a consultant, and that's when they want to start a family and have kids. But a lot of people don't have that luxury. I think like a lot of, and this may be partly because I went through postgrad, but there were quite a few people at uni who had kids. And I think the word at that time was that medical school is actually quite a good time to have kids, because you've got a bit more flexibility. You're not doing sort of, you're not on call overnight, you're not doing after hours shifts. You'll actually see your kids, and you can take years off your training. Like you can take a year off, in between, in between your study. That's usually not an issue. Obviously it's tricky because you're not working. And so, being able to support your kids is the I suppose, one of the big considerations there. I think the other probably good time to have kids is when you're doing your specialty training. So when you're a registrar and you're once you're on that training program, you have a little bit of job security for a couple of years. And sort of once you're on there, they don't really want to kick you off. And so usually they're pretty accommodating, if you want to have a couple of terms off or you want to have a year off. Obviously, it's not a blanket rule, and some colleges are better with being accommodating than others. I think if you want to have a family I suppose I'm talking about starting a family, so having kids. I mean, if you've already got kids, then you just kind of make it work. But kids during internship and residency is probably pretty tricky, because you're doing a lot of those sort of after hours, night shifts, those sort of things. You're working weird hours. And also because you're thinking about then applying for those more competitive positions. And that can then mean you're doing extra research, you're putting extra time and effort into lots of other things, and it just becomes a lot on your plate. And I suppose, again, that comes back to what sort of specialty are you thinking of? Are you thinking of doing something that's a bit less competitive, in which case, that might be doable? Or are you thinking of doing something that is more competitive, that's going to need, research and teaching and all those other kind of extracurricular bits and pieces to try and get on in the first place? But, it's tricky, but I suppose, working and having kids is tricky. I don't think medicine's, unique in that. But I think there's definitely some times that make a bit more sense than others if you're sort of considering that.
Yeah, thanks for that, Chris. Do you actually have any personal experiences or stories of some really tough times in hospital, perhaps the death of a patient or a really tough family situation that you'd like to share with the listeners?
Yeah, there've been plenty. I suppose the first time I saw a death was as a med student, and I was on an ambulance ride along for a day, and we got called to this bloke out in Orange, and we got there and he was dead, and he was like a middle-aged guy with a job and a family and kids, and we just he was just sitting dead in his car. We presumed a heart attack, and we took him into hospital, but we didn't do any CPR or anything like that. And that was pretty confronting, especially as a med student, where you think like, oh, all this learning's great, and then you go out into the real world and you're like, oh, okay, righto. And I think other things like, when you meet a patient who you can relate to or somehow you sort of identify with, so whether that's sort of similar age or similar sort of life circumstance, or maybe they're they remind you of your grandfather or something like that, and then to see them not do well, or to see them die, or to see them in pain, or that sort of thing, that can be really hard. And I think doing a pediatrics term is really difficult in some ways, because you see these kids who are 2 and they're dying, and that's pretty tough. So there's definitely hard bits. And I think having a support network and having someone that you can debrief with for those sort of things is it's really crucial.
Thanks, Chris, for sharing that. Do you think the public or people who are non-doctors have actually an accurate representation of what being a doctor is like?
In some ways, maybe, and I suppose it depends on whether whether they know someone who is a doctor or not, or whether they're just basing it off, Grey's Anatomy. or house. I suppose, some of the misconceptions, common misconceptions would be that it's really well paid. And I suppose I think I mentioned this in the book, but there was one of the, so she was an unaccredited registrar. So she was doing one of those training years to then hopefully get onto a training program. And when she, her take-home salary was okay, but once she factored in the amount of overtime she did, and all her sort of medical supplies and equipment and insurances and everything like that, because a lot of her overtime was unpaid, I think she worked out that she was just above minimum wage in terms of per hour. I think she was just above, maybe she was just below, but she was definitely around that point. So, I think that's a fairly common misconception. And I suppose on the flip side, the opinion that sort of specialists charge too much. So, they'll go to see a specialist and, be charged $200, $300. And yeah, that's a lot of money. But I suppose you're paying for the however many years of experience and that sort of thing. And from that specialist point of view, they may well have been on almost minimum wage until their mid-30s. So, I suppose that's that's one thing to keep in mind. I think it's not particularly glamorous like Grey's Anatomy makes out. I think a lot of the time you're really tired and you really want to have a day off, or you really want to go and see your friends, but you're on call and you get called back in. And you've just got to kind of cop that. And I suppose we've kind of alluded to this, but, probably the conception is that you just pick what you want to do and you go and do it. But it's not always that straightforward, and it is quite competitive. I suppose the truths, or the sort of the right view of things, doctors usually work pretty hard, and it is a pretty rewarding job. And I think when I talk to other people in other, in some other careers, and they tell me what they do each day, it just doesn't seem as fulfilling. And that's not a slight on their profession. There are other great things about it. But there's something really cool about, being able to fix someone's health. But I suppose it comes down to what the public's preconceptions of medicine are, and I'm not sure I'm in the best place to to know that. I should be asking you that.
That's true, yeah. I think you answered that beautifully. So, yeah, thanks for that.
That's right.
Final question. We've talked a lot about how hard it is to be a doctor. How do you stay sane? What are some things that you do that keeps you motivated, that keeps you energized?
So a few things. I'm a Christian, and that kind of puts everything into perspective, or at least I try to as much as I can. And I think that's really helpful when you see things that are really challenging, or you're just having a really rough time, to be able to have a worldview that gives an answer to that, and gives an answer to suffering and that sort of thing. I suppose having a support network is really crucial. So my wife's a physio, which is really good because it means she's not a doctor, so she's not working the same hours or working the same, doing the same silly things. But she kind of understands what, what working in a hospital is like, what the different pressures are and that sort of thing. Which is really good. And I suppose just keeping, having interests outside of work as well, like with anything. So I do a lot of skiing, I do a bit of mountain biking, which is not so good when you break your wrist on your mountain bike and you're trying to be a surgical trainee, but that's okay. But it's worthwhile. Yeah, so I suppose just having things that you can do to take your mind off it and keep you healthy. Yeah, and I suppose mental health is a big part of that as well. So, yeah.
All right, guys, that's all we have time for today. Thank you so much, Chris, for joining us. And for anyone who's got any more questions or wants any more clarification about what we've just talked about, Chris has a book available. Like I said, it's called So You Want to Study Medicine. It's a beautiful red color book right there. And and stay tuned for more content about career advice and to hear from experts in the various industries. So thank you so much for tuning in. See ya.
Easiest way to find the book if you want to read a little bit more about it, or you've still got questions after the interview, you can find it on Amazon or on its website, which is soyouwanttostudymedicine.com. Yeah, you can just download it directly there.